The very first thing I did when I came to this place was write to the Secretary of State for Health and Social Care, along with my constituency neighbour, the Honourable Member for Cheadle, about the state of Stepping Hill Hospital. It is consistently the biggest issue raised with me by patients and by staff, many of whom are my constituents. And there are few ways to see more clearly how the last government let down my constituents than the state of the buildings at Stepping Hill Hospital. A number of buildings have had to be closed because they were deemed unsafe, and this places more pressure on staff and on services. The repairs backlog at Stepping Hill is reported in the press to exceed £130 million, with millions needed to eradicate the most high-risk needs. This sounds abstract. This amount of money is difficult to get your head around. So what does it mean to staff and patients? It means people, my constituents, write to me having experienced major health issues like cardiac arrest and having been forced to wait in overcrowded areas without seating because there isn't the space available. It means hospital corridors flooding and medics having to wade through the water to get to their patients. And on one occasion, it means a constituent writing to me on what should have been the utter delight of having a baby delivered safely into the world. But 30 minutes before the baby arrived, the light fitting fell down in the delivery suite in the middle of active labour. Stepping Hill sees around 500,000 patients each year, and when I ask my constituents about their experiences of Stepping Hill, many tell me they're worried about the buildings, but so many of them praise the phenomenal staff. I'm going to share with the House a few of those. Chris said staff could not have been kinder or more efficient. Alan said all the staff at Stepping Hill from top to bottom were absolutely brilliant. Brenda said the staff remained dedicated despite the state of the buildings. Amanda talked about how without Stepping Hill and the wonderful doctors and nurses there, my son would not be here today. And Sheila said staff were run ragged but were amazing. The previous government failed to provide the funding that's needed for Stepping Hill, and despite the huge repairs bill, Stepping Hill was left out of the new hospitals programme. The legacy of that decision and of the failed Conservative government hangs over my constituents, and they deserve better. That government broke their promise to my constituents, and I will continue to work with this and any future government to get Stepping Hill what it needs. And in part, Madam Deputy Speaker, that involves a new site in Stockport Town Centre. I'm working closely with Stockport Council and the Trust to push for that, which could act as a diagnostic centre, could act as an outpatient centre, and is surely part of a strong long-term solution to ensure that patient needs are met and my constituents get what they need. The health of our nation is directly linked to the wealth of our nation, and my constituents, whether patients or staff, are looking for the government to have their back, fund the repairs in Stepping Hill and deliver the new additional site in the town centre.